Hi everyone, welcome to this second webinar as part of the Campbell webinar series. This one is on supporting the evidence synthesis response to the COVID-19 pandemic, the COVID End Network. Let me introduce you to the chair of this webinar, Howard White, CEO of the Campbell collaboration.
Okay, thank you, Audrey, and welcome everyone. As Audrey said, this is the second in the 2021 Campbell webinar series. We're having a webinar each month throughout this year on the, I'm going to say second Tuesday of each month, which I think that probably is today, at around the same time. So please do look out for the webinars each month. Sign up to our newsletter if you've not signed up to our newsletter already, so you'll get regular information on what the future webinars are. The next couple are already up on the website. The Campbell webinar series is sponsored by the American Institutes for Research, so we're grateful for them for the core support they provide to Campbell. Allows us to put on this webinar series amongst other things. The speaker today is Jeremy Grimshaw, who is a senior scientist at Ottawa Hospital Research Institute, as well as being a full professor at the Department of Medicine at the University of Ottawa. But most importantly, of course, Jeremy is the president of the board of the Campbell collaboration. Jeremy's been active over the last year now, I must speak over a year, in the COVID End, which is a pan-evidence synthesis body response coordinated out of McMaster University by him, but with him as one of the coordinators, to have an evidence synthesis response to COVID and attempting to coordinate the evidence synthesis response to COVID to inform policy response. So I'm going to hand over to Jeremy. He will speak for about 40 minutes. If you have any questions, please put them in the chat box. So anytime you want, just put a question in the chat box during the talk, and when we come to the end, then I'll mediate those questions and try and group them in a sensible order if I can, and pass them on to Jeremy for response. We have 1 hour, so 55 minutes from now. So thank you, Jeremy, for coming to speak to us today, and over to you.
Thank you. So I'm just going to share my screen. So good morning, and thank you to Howard and Campbell for this invitation to present to you today. What I'd like to do is talk a little bit about the role of evidence and evidence syntheses during a pandemic, then describe the COVID End initiative, and finish the talk by discussing the implications of COVID and what will happen beyond COVID for Campbell. So I think everyone has been touched by the pandemic. COVID-19 has really been the greatest health and societal challenge that the world has collectively faced in many decades. And one of the real positives in many ways is that policy, public health, clinical and citizen decision makers are actively seeking evidence on basically how to prevent, manage and mitigate the effects of COVID-19. And the demand for evidence has probably been greater than we've ever had previously. Another positive has been there's been a dramatic global increase in both basic and applied health research around particularly the management of COVID, although there has been much less research in social and economic consequences or mitigation of the pandemic. But one of the major challenges, although we have this big uptake in individual studies, we know that individual studies are rarely sufficient by themselves to inform the policy, public, clinical, or individual decisions. Individual studies, no matter how good they are always flawed, and we also want to, so we need to sort of think about what the implications of the study are, recognizing any sort of methodological weaknesses, and we also want to look to see whether when we repeat the studies or similar studies in different settings, we're getting similar results. So we want to know about the generalizability of these studies. And that leads us to really want to use evidence syntheses as a knowledge unit to inform any decisions. So this shouldn't be new to anyone on this call, but evidence syntheses use formal, explicit, rigorous methods to bring together the findings of studies already completed and to provide an account of the totality of what is known from that pre-existing research, and they should be used to inform decisions. So evidence synthesis basically reduce the risk of being misled by primary studies, and really should be the type of evidence that we use to inform our decision making. we now have a broad range of evidence synthesis methods that allow us to address virtually all questions that you could think of. These are the type of questions that we often look at in healthcare, but I think you could also very easily think about what the equivalent of these would be within a social and economic sector. And the key issue here is that this isn't just about the effects of interventions. We can look at reviews of the burden of the pandemic on individuals, families, societies. We could look at the effects of policies to try and mitigate the effects of the pandemic, for example, on school opening or allowing children to catch up educationally, I would say return to education. So the main message from this part of the section is that we should be looking for evidence syntheses to inform our decisions. What are the benefits of using evidence syntheses to inform decision making? And this is, these are slides from my colleague John Lavis. They reduce the likelihood that decision makers will be misled by research by being more systematic and transparent in the identification, selection, appraisal, and synthesis of studies. And it addresses basically the problem of people cherry picking studies that support their arguments, as opposed to looking at the totality of evidence and trying to make sense of it. They can increase confidence among decision makers about what can be expected from an intervention by increasing the number of units for study. They allow decision makers to focus on appraising the local applicability of evidence syntheses rather than having to do the syntheses themselves. If you've got a high quality Campbell review, you can think about what does it mean for me in my setting, rather than having to go and do a very a challenging sort of review by itself. And it also allows stakeholders, including public interest or civil society groups, to constructively contest research evidence, because it's more laid out for them in a more systematic and transparent way. So we, evidence is open to interpretation. People can look at the same evidence, same body of evidence, and come to different conclusions. But if you have a systematic review, that means that everyone is looking at the same body of evidence. It helps to understand that basically these are different interpretations driven by values or preferences, rather than the fact that people are looking at different parts of evidence. So it's a very powerful way of addressing, sort of trying to support people to make decisions, and also recognize the sort of plurality of perspectives that societies and citizens have. So what happened during the COVID pandemic? Well, what we found in the first 2 or 3 months was a very substantial increase in evidence synthesis and supporting activities. There were a lot of groups that basically pivoted from their whatever work they were doing before to do reviews that were relevant to the needs of decision makers in different jurisdictions around different aspects of COVID. That was a real positive. It demonstrated that our community could really sort of try and address substantive societal challenges. But there were a number of problems with the way that happened. First of all, although a lot of the work was being done by quite experienced synthesis groups like those involved in Campbell, there were also a lot of new entrants to the field, people who weren't that experienced in synthesis and didn't necessarily know the 30-year methodological developments that we've had. And so often we're a bit naive in their kind of methods or their approaches. There's a focus on rapid reviews. We need an answer to this next week. Go and do a very rapid review on what we know by next week. And bring it back to us. And they focused largely on clinical and public health topics. Very little work was done on the economic and social implications of the pandemic, even though that was or is likely the more challenging areas. So we had variable quality and transparency reviews, duplication of effort. So I'll give you an example of that. A lot of these rapid reviews were published in the grey literature and then were not easy to find, and most of them were out of date given the rapidity with which evidence was being accrued within weeks of their publication. There were relatively few groups at the time started doing living systematic reviews, and also there's an inequality in terms of the capacity to undertake and use reviews in LMIC settings. So although there are many positives, there were a number of process and structural issues that were a challenge. This is an example of the duplication of effort and done by 2 colleagues involved in COVID-19. but they basically wanted to have a look at how many systematic reviews were there of imaging, so radiology tests in children with COVID-19. And they identified, I think, 17 different systematic reviews when the primary literature only had 15 studies. So we had more reviews than primary studies. A lot of these reviews were incomplete. They didn't identify all of the primary studies. And the danger was that they were generating a lot of noise without actually, which could be misinforming decision makers. Another example, colleagues at the National Coordinating Centre for Methods and Tools in Canada did a review, a rapid review early in May on the effects of maternal and fetal exposure to COVID. And they had a planned update, they were going to plan to update it in August. And by that time, they identified an extra 50 rapid reviews had been done during those 3-month periods. So you had this huge amount of inappropriate and probably wasteful duplication of effort, and often not high quality reviews that were sort of basically potentially adding noise to the signal. So there's a fundamental noise to signal problem. It felt like you're trying to pick up basically radio waves through the static in terms of where's a high quality evidence that we can trust. There's also a silence problem. So particularly in the economic and social side, within COVID-19, we've been basically trying to screen all the reviews that were produced relevant to COVID. And so far, only about 2 or 3% of those reviews actually address economic or social issues, despite the fact that that, I think, is going to be the major challenge as we kind of try to either learn to live with the pandemic and or come out of it. If you want to know a bit more about this, Jeffrey Brainard in Science did a great paper, a great sort of news article in terms of sort of just some of the challenges of trying to make sense during evidence synthesis during this sprint phase, these initial months of the COVID pandemic. So that brings me on to discuss COVID-19, which kind of formed in response to some of these issues. And particularly would like to recognize John Lavis as the other co-lead of COVID-19, and it's actually largely being run out of his group in McMaster. And we're also sort of joined by David Tovey, the former editor-in-chief of Cochrane, as a senior advisor to COVID-19. Here are our funding for COVID-19. We've recently got funding from the Canadian Institutes of Health Research. But before that, we had funding from the Government of Ontario, National Institute of Health Research in the UK, and a number of individual philanthropists in the US. What was quite remarkable is in my career, this was the first time that people came to us and asked if we needed funding. And I think that demonstrated some of the sort of recognition of the challenges the pandemic posed. So what is COVID-19? We're a time-limited network. We are only going to be in existence for as long as we think we're providing value to the evidence community and the evidence users of evidence during the COVID pandemic. We sincerely hope that we will not be in existence in 12-month time from here. But we came together because we recognized this explosion of activity that was happening in the evidence synthesis world, the lack of coordination, the variability in the quality of the reviews, the focus on rapid rather than more substantive, rigorous reviews. And fundamentally, we wanted to know, could we find ways of trying to encourage the evidence synthesis organizations around the world to kind of work together to try and better address the pandemic to meet the needs of decision makers. So we wanted to advance the evidence ecosystem, particularly related to COVID-19, making the most of the interest and demand for evidence synthesis, and also making the evidence synthesis even more robust and resilient in future. And we wanted to help strengthen existing institutions and processes such as Campbell. So that was what we were trying to do. Here's some of this is an incomplete view of our current members. We have about 57 organizations at this point in time, and you can see we've got geographic representation with the Africa Center for Evidence, the African Evidence Network, the American University of Beirut in Lebanon, Epistemicus, which is based in Chile, Fiocruz from Brazil, also from different sectors. So we have a lot in health, but we also have the Campbell was involved involved in this from day one, the Epicenter, 3IE, other groups around that. So we tried to capture, basically any group that we thought was at, largely working at a national or international level, trying to produce high quality systematic reviews and evidence syntheses, who were interested in trying to work together to work in a more cohesive way. This happened remarkably quickly. I think we had our first discussion about the need for this around the end of March, and we sent out an email to about 15 of the evidence synthesis organizations globally on the 4th of April, including Campbell. And we had exploratory meetings on the 6th, 9th, and 13th of April. And we had a name and logo by the 16th of April, and we were up and running with the working groups we established by the 14th of April. So, within the space of 2 weeks, we actually, or less than 2 weeks, we pulled together, what had never really happened before, a sort of a substantive group of originally about 40, as I said, we're now up to 57 organizations globally, trying to do something in this space. The initial work, we created 7 working groups, and we asked each of those working groups to sort of basically what could be done in weeks that might be helpful for better promoting collaboration and cooperation, reducing duplication in the evidence synthesis response, and linking to decision makers. And here were some of our early achievements. We very early on had a guide to key COVID-19 evidence sources. So we had identified those groups around the world that we thought were producing high quality syntheses, and had a list of, if you like, preferred providers. This gave the opportunity for people who are trying to identify high quality evidence syntheses, instead of just going to Google and being overwhelmed by a lot of noise, of saying, here's the 10 organizations whose website I should scour. And we know that WHO, for example, use that when they're preparing for press conferences or rapid reviews, and other colleagues around the world would regularly use this as their go-to place as a starting point to try and find evidence. Working with colleagues in South Africa and Chile, we identified, or we created a living hub of COVID-19 knowledge hubs. So these were all both the synthesis groups, but also the data shops and other groups around the world that were working on COVID-related work. And the idea was that if you were in West Africa and you wanted to know, who in my region is working on some COVID-related work, you could use this as a way of identifying them very rapidly. We created a taxonomy of decisions where we thought evidence was needed, that covered both sort of public health measures, clinical management of COVID-19 and pandemic health related issues, health system arrangements, and the economic and social responses. We also very quickly put together a set of resources and principles to support evidence packaging for different decision makers, supported by, for example, people in the communications department from Cochrane, and a description of an evidence support model. So one of the things that we've managed to do with McMaster in Canada is basically provide a very rapid overview of what evidence is out there within a 3 to 4 hour timeline, that certainly in Canada we found has been very attractive to a number of our decision makers. We've provided tips and tools for those supporting decision makers, and also resources to support researchers who were considering or conducting evidence syntheses. And this was particularly focused on those new entrants who might not fully understand the resources and methods available for people interested in doing systematic reviews. And then also the WHO asked us to join the Secretariat function for the WHO Evidence Collaborative on COVID-19. So these were all up and running by probably midsummer. We hope sort of were basically helpful in terms of pulling groups together. As we got through that first phase, that first wave of COVID across most of the globe, it became apparent that COVID was something that's going to be around for a while. And John coined the phrase that we're moving from a sprint to the marathon phase. And we need to think about what evidence will support decisions best in that marathon phase. Given some of the sort of structural and process issues that we saw in the sprint phase with inappropriate duplication of effort, to focus on rapid reviews, less rigorous methods, not discoverable approaches, what does the world need if we want to support decision makers during this, this next phase? And we argued that the world would be best served by a global stock of high quality, accessible, and actionable living systematic reviews that address the most important healthcare, public health, health system, and economic and social issues faced by decision makers. If we could identify, say, the 200 to 300 questions that keep coming up in different countries around the world as they experience the pandemic in their own time scale, it would mean that when colleagues in Ghana were interested in interventions to promote social distancing or whether quarantine worked, instead of having to go and do a rapid review where they'd cut a lot of corners, it'd be a high quality review that they could actually use to think about what does this mean for us. They may still have to go and do some more local research about, well, what's our capacity to do these things, but there'd be something there that was a good starting point without them having to, start with what looks like a blank sheet and having to start to pull the synthesis together. We need to, we also need to ensure that there will be evidence synthesis capacity to undertake those high priority syntheses efficiently where we don't have high quality systematic reviews. So if we don't have a living systematic review on a public health issue that's particularly relevant, Ghana's my country for the my African country for the morning. They still need the local capacity in Ghana to be able to do the review very quickly for their needs. We also thought that we needed to invest in local evidence support initiatives to help decision makers to find, interpret, and contextualize the best evidence to meet their needs. So the recognition that increasingly we need evidence intermediaries that really help people who are incredibly pressed in ministries or public health departments who probably have only minutes of bandwidth available, help them to find the evidence and make use of it. And we think we need a kind of global evidence infrastructure to build on existing organizations to deliver coordination and prioritization and more efficient conduct and sharing of high quality reviews. And of course, we need to have secure funding. So here's what co-ordination is currently doing. We're creating, instead of having an inventory of best evidence sources which says, go and look at these 10 websites, we're creating an inventory of best evidence syntheses. So using our taxonomy, we have now scanned around 5,000 syntheses produced during COVID, and we're trying to identify those syntheses that we think are relatively up to date and high quality, and creating a database that says, basically, if this is your question, either there aren't any high quality up to date reviews, or here's the reviews that we think are worthwhile of looking at. And so when we do this, we're pulling from a lot of work of partner organizations who've identified reviews for us, but we basically note when the last search was made. We rate them on AmStar to set the quality of them and whether there's an evidence profile available, and we provide a declarative link on those. I'm going to go through that, but here's just what it is on the COVID-19 website. And so you can see this in the public health area, and for infection protection, prevention, personal protection, we've identified 2 reviews that are, both of them look as though they're pretty out of date, but actually sort of do kind of provide information on what's on interventions to try and promote hand washing. A second area is that we were very concerned that groups were largely sort of, what's our knowledge gap in the next week? And there's very little sort of strategic thinking ahead of what are the kind of issues that we as a society are going to face in the next 3-6 months. So we've actually convened a global horizon scanning panel with about 40 participants who every month come together. We scan the media, the scientific literature, these things that we think are emergent, and we put those in front of the horizon scanning panel. But we also ask those individuals to, from their perspective, tell us about what are the challenges that are their country, their jurisdictions are facing, where better evidence, better knowledge would be useful. And we publish that on our website in terms of here's the areas where we think it's useful to have living reviews. We we take the horizon scanning and we look at what's in the inventory. And then what we're trying to do is identify what is the core set of these 200 to 300 decisions where if we had living systematic reviews available, it would dramatically help people around the world to focus on making sense of the reviews rather than having to do the reviews. So we're creating a list of priority topics. We're just starting this work now. And then we're kind of basically going to try and cajole, encourage and nudge groups collectively to take responsibility for a full set of living reviews addressing these priority areas. So what we're trying to encourage groups to do is instead of saying, well, we've got to do, we can do half a dozen rapid reviews in the space of 2 months. Well, if we actually focus on a review, say, of school opening, and we're confident that other groups around the world are doing equally high priority reviews to be relevant to our local decision makers, then globally we're addressing the needs of the world rather than sort of doing this frantic hopping from review to review locally and probably not sort of providing a sustainable model. We've also created a broader COVID-19 community listserv. So this is for anybody who's working in the COVID space and wants to know about, evidence syntheses and how they can contribute. And we currently have 300 members from around the globe, and we have a number of discussion topics where we kind of basically ask for people's experiences in relation to, did you have to change your work methods when you were starting to do rapid reviews? What were the kind of shortcuts you took? How did you think that through? There's also a webinar series, and we're planning to summarize and share these insights. So again, the COVID-19 partners are the kind of what we think are the 57 leading evidence organizations globally. But this brings in sort of basically anyone who's interested can join. And if you're interested in this, then you can go to the COVID-19 website and sign up. I mentioned at the beginning of this section that the Institute of Health Research had provided funding at the end of last year for COVID-19, and basically that was going to fund some of COVID-19's global activities, but also with other partners across Canada, particularly the Small Evidence Alliance and Cochrane Canada. It also provided funding to do more rapid reviews and living rapid syntheses to meet the needs of Canadian decision makers, and also see if we could coordinate the demand side in Canada. We have 10 provinces and three territories, and there's a lot of similar issues popping up over those jurisdictions, but to date no one's really actually put them together and said, actually what these 5 provinces need is this review, let's move ahead and do that. So this is a bit more parochial, and it's very Canada, where the rest of COVID-19 is global based, but this is kind of where we're just setting this up at this point in time. And the final sort of priority is sort of global coordination and collaboration. As I said, we with Cochrane have joined the Secretariat of the WHO ECC19 Evidence Collaborative for COVID-19 group, which involves other groups, often sort of national agencies that are doing responsive reviews in their jurisdiction, but again to share resources, encourage cooperation and collaboration. And we're working on a position paper to sort of basically think about what are the implications of our experiences today in relation to COVID-19 for the future evidence synthesis community. And at the moment, one of the things that we're doing is we're currently working with partners to scope out an initiative for a global commission on the future evidence synthesis for evidence-informed decision-making. Given that we've never had this demand for evidence at such a level, this is an opportunity. There may be a window where we can sort of basically talk about how we can think about re-engineering the current evidence synthesis community, building on those institutions that are there already, but to make us more fit for purpose, responsive to the information needs of decision makers, adequately resourced with adequate infrastructure. So that's something we're working on just now. So just to summarize, COVID-19, COVID-19 was basically formed as in response to the kind of explosion of primary and secondary research related to COVID. And really what we sort of see is an opportunity to move from the initial high noise to signal evidence phase, where the emphasis was on rapid reviews or variable quality, they were quickly out of date, there's huge duplication of effort, you had to go and find them, to a high signal to noise evidence phase, which is curated, high quality living evidence syntheses and evidence support initiatives. And we also want to work with a wide range of key decision-making bodies to support that. So that's kind of COVID-end in a nutshell. I want to move on for the last section to talk a bit about the Campbell COVID-19 response, because I think Campbell as an organization very rapidly was able to draw upon its 20 years of work to and community to do work which was relevant to the COVID-19 response. I also think that to date, given there's been so little work done in the economic and social sectors, there's a huge role for Campbell as we try and build back better as we move forward. So if you're entering the Campbell COVID-19 response, if you go to the Campbell Collaboration website, you can see that here there is a COVID-19 tab that you can click on. And this will sort of take you to a number of sort of initiatives that Campbell did. So I think by either early to midsummer, we basically produced a virtual issue of the Campbell Journal related to COVID-19, where we identified 50 systematic reviews relevant to policy response to COVID-19. Now, one of the issues is that in contrast to health, there wasn't a lot of new economic and social research being done, but there's a lot of economic and social research that had been done previously, summarized by Campbell, which was COVID relevant. So we didn't really have COVID specific reviews, but we had a lot of COVID relevant reviews that could help decision makers around the world to think their way into how we think about education, crime and justice, international development. And there's an editorial that was sort of authored by all of the co-chairs of the different convening groups, as well as the sort of secretariat. So that's really worth going to have a look at if you've not had a look at it. Campbell also formed a partnership with Evidence Aid. So Evidence Aid is it's an evidence intermediary that basically tries to make evidence available to decision makers and societies that are facing natural disasters and global challenges. It's been in existence since the 2003 or 4 tsunami. But what Campbell did, what they have is a great network into these sort of disaster groups around the world, and they feed information from systematic reviews to them from the health and the economic sector. And so Campbell has basically made sure our reviews are well represented in the Evidence Aid resources, so that people can access those and think about the economic and social issues they need to deal with. The other benefit of working with Evidence Aid is that Evidence Aid also basically produces summaries in, I think it's the 6 WHO official languages, but really sort of makes a lot of our work linguistically accessible to individuals. And then individual Campbell coordinating groups also basically sort of did a number of activities around this. So here's just 2 examples from the International Development Group, and also the Crime and Justice Group. There's also on the Campbell blog a special blog series on responses to COVID-19. So you can see that basically this was trying to summarize Campbell reviews on the immediate response, on the economic response. So again, trying to make the body of work that Campbell has developed and curated over 20 years accessible, put it in front of decision makers, and really help Campbell reviews to inform their decision making. And also, I think I mentioned from that Campbell was one of the founding members of the COVID-End network. So I would say so far so good. I think Campbell has made a great contribution to the evidence synthesis pandemic response. But I think we need to recognize that we're moving from a sprint to the marathon phase. During the sprint phase, we basically repackaged a lot of COVID relevant Campbell reviews to put them in front of decision makers. But I think there are now, as we move into the marathon phase, basically going to be things where we need to think about, can we develop new reviews meeting the emergent challenges of decision makers globally? And for example, Zulfi Bhutto has already, I think, registered 3 Campbell reviews around nutrition issues that are highly relevant during the pandemic. The other issue is that societal recovery from COVID-19 is likely to take years. Even if we get through the public health and health major consequences in the next 12 to 18 months globally, it's going to take us, probably a decade, I would have thought, as a global society to recover. And so we also need to think about, well, what are going to be the evidence needs for those countries and jurisdictions over that period of time? How can we sort of basically meet that challenge? What can we do? And I think this is a significant opportunity for Campbell if we choose to take it. I think this is one of those things where we should be thinking very strategically to say, how can Campbell help the world to recover from the COVID-19 pandemic in a better, fairer way, meeting our strapline evidence for a better world. So we have this opportunity to rebuild better, so Campbell should be there. And I think this is being recognised in different sort of fora. So the UN produced a COVID recovery research roadmap. And basically, one of the things that was argued is, yes, in the initial phase, it's been the health and the public health issues that have been major sort of societal challenges. But as we move forward, it's going to be the social and economic issues. And they looked at the SDGs and identified a whole range of areas where, basically the pandemic is challenging progress in those areas, and where we need to think creatively about how we can basically get back on track with the SDGs and in fact move forward more quickly. So if you haven't had a look at this report, I'd encourage you to do so. So if you can see the top research priority was, how can COVID-19 economic recovery efforts be purposely designed to stimulate equity, resilience, sustainability, and progress towards the SDGs. This feels like it is absolutely in Campbell's scope and remit, and we should be thinking about, well, how, what can we do to help do that? And within the document, as well as these high-level research priorities, they give, basically sub-questions. So what can be done to ensure remittance systems are safer, more equitable, affordable, and convenient for this area? How can food supply chains be secured for the world's most marginalized populations to ensure food security and nutrition in all circumstances? These are kind of, for me, core business of Campbell. We should be saying, first of all, we are part of the evidence response to this, and we can actually sort of help start to develop syntheses that would address these areas. Within the strategies for better recovery, they highlight the need of implementation science, rapid learning systems, and knowledge mobilization. And this particularly, I think, is sort of, again, in our area, very much talks about needing to use the currently available evidence to help both plan future research needs, but also policy and practice at this point in time. And again, this seems to me, it's basically opening the door to a group like Campbell to say, we can actually do, we can be involved with and really help support a number of these activities. So basically, what some of the conclusions of the roadmap is that, as researchers, we need to tackle complex research priorities and inform transformative solutions for problems that COVID-19 has revealed and created. Research funding agencies will need to work together to ensure sufficient and coordinated investment to address these research priorities. So my hope is that research funding agencies will start to commission Campbell-like or reviews in the scope of the Campbell collaboration, that if we are nimble and if we are prepared to basically run hard at this, should allow us to basically get proper funding to actually do the work that we do. I think too often we've been working with insufficient resources, and that's meant that we haven't been as agile, we haven't been as rapid as we'd like to be. But I think there's going to be opportunities for funding which will help take us forward. And also this idea that we need to encourage governments and civil society organizations to basically demand the research, tell us what their needs are, help us make sure that we are creating evidence syntheses and products that meet their needs, and basically find ways of institutionalizing using research in decision making. So this is an amazing opportunity if we can grab this. If the world can actually sort of fully sort of respond to the recovery research roadmap, we have an opportunity to make the world a better place, and Campbell should be front and center to that area. So for those people on the call who are involved in Campbell, we should really be looking for how this will get moved forward. I wanted to end just with just with some reflections. The person in the little purple box, this is a screen capture, but is Larry Hedges, who gave the opening plenary at the What Works / Campbell Global Summit this year, and it was a very, as you would expect from Larry, a very thoughtful presentation. One of the things he observed is that often in the economic and social science sectors, reviews are done for academic purposes, helping us advance theory, and often they're not particularly thinking about the problem from the policymaker, the user of evidence. And here in his lecture, and I'd encourage people to dig it out, he was arguing we need to develop a new strata of evidence syntheses practitioners and structures like Campbell in the economic and social sector that is very much policy oriented, that's very much trying to meet those immediate needs of decision makers to allow them to use evidence to inform what they do. Now, I think the last 5 years we've seen that really starting to build with a lot of the What Works initiatives. But again, I think we need as a community to think about how do we make sure what we do is going to be helpful to the world in this next 5 to 10 year phase coming out of the pandemic. So this is the kind of my summary for the Campbell bit, but the world will need high quality reviews to inform recovery from COVID-19, especially in the economic and social sector. There are substantial opportunities for us, including funding if we're prepared to grab it. We may well have to do things that we might feel uncomfortable with. We may well basically find ourselves in a position where we're being asked to do rapid responses and rapid reviews, and we need to consider whether we feel comfortable about that. But I think one of the issues is, I think when we do a rapid review, we should recognize that in general, the questions that we're being asked are likely to be on the policy table for the next 1, 2, 3, 4 years. So if we do a rapid review, we should try quickly to turn that into a full systematic review, and then if appropriate, a living systematic review. So we shouldn't see we're only being asked to do rapid reviews as somehow a limitation. It's our way to start the journey to create high quality living reviews for the needs of decision makers. And I think also this will help us raise the profile of Campbell internationally, both in the policy, the research, and the economic and social communities. So that's what I had to say today. In the last slide, you've got my email and Twitter, you've got the COVID-End website, email and Twitter, and the Campbell collaboration response to COVID-19. So again, I apologize for the disruption that we had early on and the sort of rather distressing both language and graphics that people put up, but we'll be very happy to take any questions that people have at this point in time, and we'll come back to the main area.
Okay, thank you very much, Jeremy. Yes, also, so if you have any questions, you can enter them into the chat box. Everyone is still muted other than myself and Jeremy. So apologies again, as Jeremy just said, for the Zoom bombing at the start. It does remind us there's up there, in addition to questions about social policies, there are questions about actually how you combat anti-vaxxers, how you use social media effectively to combat false messages in social media, and so on. So these knowledge translation issues that organisations like Centre About Science from the UK and US have been engaging with to combat the growing movement to non-scientifically based opinion that gets credence by Hollywood celebrities and so on supporting nonsense views is something we have to take very seriously. Systematic reviews are part of that because they actually say, nope, this is what the evidence says, but then we have to know how to translate that in a way effectively, which I think means better engagement, not just with decision makers, but with the public, through the media and so on. And we do have in Campbell a knowledge translation group that works in this area, but it's still really an under-considered area of knowledge translation. We have different views about how we, models about how we go about that, but actually reaching out to the public and co-production with agencies and members of the public and so on is something Campbell's not done to date to the extent we could be doing, and as we expand in the future, hopefully we'll do yet more of. So I'm just going to keep talking till I see a question. So if you really don't want to hear me anymore, you have to, because I can talk for hours. You just have to, so I can undo my video as well. So you have to ask me a question. Ah, there we go. Thank you. So Jose has asked a question now on, you can see it also, Dan. It's only one. We have Jeremy, so go ahead. Okay.
Yeah, thanks, Jose. So there's a number of ways in which we can do this. One is that a number of partners in COVID-End have created evidence maps, and as part of those evidence maps, they've also been identifying trial, records and trial registers that are relevant to the particular topic areas. So in particular, the James Thomas at the Epicenter, but also Gunvis is on the line, and they host the I think the Evidence Center map, and also the number of COVID network meta-analysis groups are looking at these registries. I think there's two things that we need. There's a number of ways that we can handle this. One is that knowing what's in the trial registries helps us know what the pipeline looks like. When is new research likely to come through? And that might help us think about, well, how quickly is this going to change over a period of time? And we can also, if you like, put alert for as soon as this comes out, we want to have a view of that. I mean, a second issue that we're facing is this preponderance, certainly in the health sector, of preprints. In fact, what we're getting in the healthcare sector is normally an institutional or company press release that gets reported in the media, that occasionally will then get into a preprint. And there's some really interesting, in fact, Sandra is making the same comment. There's some really interesting issues around the stability of preprints, how many of those actually move forward, what happens during the peer review process, do they improve? So I think also one of the kind of methodological issues we're trying to grapple with, and there was a paper, I think, coming out of the COVID NMA group with Cochrane France, I think Isabelle Boutron was an author on that, was actually looking at sort of the life cycle of preprints and whether they when they get published, whether they get changed or not. Sandra, I mean, at this point in time, my sense is that as synthesis, we need somehow to recognize the preprints during our synthesis products, during our synthesis process. If we don't, we sort of basically risk the danger of being seen as being sort of out of touch. But the New York Times reported this trial. Why isn't it in your systematic review? So I think we have to have a way of including them. We need to put health warnings around them. We need not to overemphasize sort of the results of something that's only in a preprint perspective. But I actually think, personally, I have no idea if we asked all of our colleagues in the evidence synthesis community whether they would agree that we need to search for the preprints. And again, these various evidence maps do that incredibly effectively, so it makes it easy for us to find them. We need to include them in our reviews. We probably need to do sensitivity analyses if we're doing meta-analysis to see if they are unduly influencing the review, and we need to put a lot of health warnings around them. But otherwise, I just worry that we would find that people will not see the syntheses as being credible, and they'll wait for the New York Times story. So the next question, if you want me just to go on, Howard, Helen Pearson said, do we have any evidence that COVID-End has had an impact, e.g. reduced duplication of efforts or helped direct decision makers to good quality evidence? So we can, the issue here, Helen, is we end up coming to anecdotes around this, but we can tell you, for example, when COVID-End started, we had a number of people sort of saying, we're thinking of doing a review in this area. And one of the things that we said to them is, what we think you should do is go and look to make sure there isn't already a systematic review available through, PubMed, these COVID relevant evidence maps, and there's no reviews that are planned, such as through Prospero. And we had a number of people coming back saying, oh, wow, didn't know about this. I found a group in York who are doing this already. So I'm talking to them, and we're not going to do the review. We're going to wait for them to do it for us. We've had experience amongst COVID-19 partners about thinking about opportunities for collaboration. So the National Centre for Coordinating Methods and Tools in Canada has had an ongoing sort of living review of school opening issues, and the Uncover group that's based in Edinburgh were basically starting to do something similar, and they've been meeting about, well, how do we actually, other ways to collaborate better in relation to this. So I think at the level of sort of anecdote, at the level of encouraging groups to come together so they understand what each other's doing, we certainly have, we can point you to stories of that. In the same way, in terms of how we help direct decision makers to access good quality evidence, I mean, some of the areas there would be with our inventory of evidence sources, not best evidence syntheses. We do know that the WHO use this on almost a weekly basis to guide a lot of their rapid response services, either for a press briefing or for policy formulation. So we know at the highest level of WHO, this was used, and again, we can give you examples of where people globally have come and said, we use this to actually help us find A, B, and C. So I wish I could have lots more very powerful and profound stories for you, but at the moment, we've got these sort of almost anecdotal stories, which are very much where we have personal contacts. So that was my response to Helen, and Jose again basically just sort of said, are we related to the work of rolling reviews published by EU-Net HTA? So we have health technology assessment agencies as one of the kind of constituent groups within within COVID-19, and we have so HTAI is a member, EU-Net HTA is. INES, which is in Quebec, the provincial HCA agency in Canada, NICE, they're all part of this process. So we're aware of what they're doing, and their reports will be being captured in the kind of resources that are being put out there. Some of the issues I think are, how the guideline community is getting its act together. And the HTA community, I think, is knowing also in that world how, what everyone's doing and how do they share resources. So I think there are kind of some specific issues in the HTA world, but clearly the HTA products are relevant to the kind of wide range of decision makers we're interested in engaging with. You're on mute, Howard. You're still on mute.
Yeah, so I'm like the rest of you, I'm muted. Only Audrey has the power to unmute people. So, so she's done that now. Thank you. Okay, thanks, Jeremy, for the responses. I would just like to, on a couple of things Jeremy was saying, I was sent a report to comment on recently on the education field and use evidence in the education field. And it was saying, well, if only there was some international body, we'd need a body that would help coordinate evidence synthesis for education globally. There is this body, it's called the Campbell Collaboration. And I've been in a number of meetings over the years where people said, oh, we need a central body to coordinate reviews on this or the other. That is what a Campbell is for. And so when you hear stories of duplication of reviews, well, yes, I'm sorry to hear that, but how do you register with the Campbell Collaboration? Both would avoid duplication of reviews within Campbell, but also we are aware through our networks of ongoing reviews and the maps we do of other reviews in the subject areas we work on are not necessarily registered with Campbell. And as Jeremy we didn't say it directly, but it's the case, there are reasons, and there's a project that Jeremy and I are both involved in, it might be necessary sometimes to duplicate reviews, but then it should be clear that's what you're doing, have a rationale for it, and the sort of process that Jeremy described, well, at least talk to the other review teams and try to sort of carve out the research questions so you complement one another rather than just duplicate one another is a good process to have. And the registry of Campbell, where we register titles and protocols, allows that process to go ahead. So I'm going to end with a bit of Campbell promotion. I mean, at a Campbell webinar, so I think that's forgivable. So I mean, do thank you all for coming. Thank you to Jeremy for taking your time to give us a presentation this evening for me, this afternoon, morning for him. Thank you, and thank you again to American Institute for Research for sponsoring our webinar series. But I do encourage you to sign up to the Campbell newsletter if you're not signed up already. Be aware of our Campbell webinar series. The next one next month actually is on an experience of a commissioner working with a map to inform the commissioning institution's own policy and practice. And so a presentation both from the commissioner and the person managing the maps, that I think will be interesting. So we're looking always for more opportunities and stories where we get more engagement in use. So do tell your friends, family, anyone you meet on the street about us, about our webinars, to encourage more people to attend. And yes, we do host we've recorded the video. It goes up onto the Campbell YouTube channel. That's a must visit every day. Just go to the Campbell YouTube video, find a nice video to watch. If you want to know about, estimating, doing meta-analysis with cluster effect sizes, you've got a video for that. You can go there and watch it of an evening rather than watching Netflix, which is exhausted by now anyway. There's nothing new to watch on Netflix. So go to the Campbell YouTube video. I think it takes a couple of days. Yep, there you go. It's up there. So it'll be there in a couple of days, thanks to Audrey and Tricia. So, and again, thanks to Audrey and Tricia for organising the webinar and ensuring it all goes mostly smoothly. And we'll try and learn from today's experience. So thank you, everyone. Have a good rest of the day, evening, afternoon, and night. So bye-bye for now. See you next month.
Bye-bye.